Morning, everybody. I'm delighted to welcome you this morning to the UCD Institute of Food and Health Research Bites. We're delighted this morning to be joined by Professor Alan Reilly. So Alan is an adjunct professor at the Institute of Food and Health. He has very extensive experience in the field with over 45 years in the agri-food sector, and particularly in the area of food safety and regulatory affairs. He's worked at the Food Safety Authority of Ireland for over 16 years and indeed held the highest post of Chief Executive of the authority in the period 2019 to 2015. And before joining the FSAI, he also worked in the food safety program of the World Health Organization based in Geneva. He acts as an advisor to the World Health Organization and to the Food and Agricultural Organization of the United Nations, and indeed is a member of the advisory board of the WHO FAO International Food Safety Authorities Network. He's also chairman of the Scientific Advisory Board of the European Food Information Council, UFIC. Currently, he's working as a training coordinator on a number of European Commission's BTSF training initiatives on food safety, emergency preparedness, and crisis management, and on investigating techniques to be deployed during official controls to deter potential fraud along the agri-food chain. So I think we are very privileged to have such expertise. So delighted to welcome you, Alan. So if you could commence your talk, that would be great. Thank you so much.
Thank you very much, Dolores. And I'm going to turn my video off while I'm talking. I'll turn it back on in a couple of 10, 15 minutes or so. Look, what I want to talk to you about this morning is some work that I've been doing with the World Health Organization over the past 2 years in really drafting their new global food safety strategy for food safety. If we look at why we have a food safety strategy, what was the need for this food safety strategy? Well, the WHO in 2020 did a re-evaluation of the estimates of foodborne disease burdens, and they came up with figures to say that there's an estimated 600 million illnesses globally on an annual basis, leading to 420,000 deaths. The World Bank also looked at food safety and came up with an estimate of $110 billion that's lost each year in productivity and medical expenses. And really, most of that burden is in lower income countries where the lost productivity and medical expenses really do impact big time on the economies of those countries. Unfortunately, the foodborne illnesses, 30% of the deaths occur in children under 5, and really it's the vulnerable groups, particularly kids, who are going to suffer most from foodborne illnesses. And against that background, foodborne diseases impede socioeconomic development. It puts a hell of a strain on healthcare systems. National economies are really impacted in terms of trying to treat sick people not being able to work. Tourism and trade really go down the drain. Who wants to go to a country where there's a high level of foodborne illness? And who wants to buy unsafe food? So really, against that background of all these different factors, WHO really thought it was time to update their global food safety strategy. The previous food safety strategy was was published in 2002. I left the World Health Organization in 1999, so I would have worked on the previous strategy, believe it or not, at the early stages of development of the previous strategy. So the strategy has been in existence for 20 years or so it was really time to update. When we started to look at developing the strategy, we looked at the food safety drivers. Now these are factors that drive change. They affect or really shape food safety and how food safety is going to impact and develop over the next 7 years. And really, the key issue here is protecting consumers' health, and that's always going to drive food safety. Governments are going to put systems in place to ensure the health of citizens are protected. Global food trade is key, as I said earlier, and nobody wants to buy unsafe food. And really, the whole of the Codex Alimentarius, that intergovernmental body that sets the global food standards, the two key issues that drive the Codex Alimentarius are protecting consumers' health and facilitating fair trade. Climate change is one of the big drivers for food safety, and it's going to impact, I think, to a much larger extent in coming years. Just to give you one example of how climate change is going to impact on food safety, I don't know how many people have heard of an illness called ciguatera. This is a toxin that's produced by marine algae, and it has been associated up to this with tropical fish. Of late, we're seeing ciguatera poisonings occurring in Europe and Spain, in the Canaries. It has encroached that far north. These algae, the algal blooms that actually cause the ciguatera, the fish eat the algae, they build up the ciguatera toxins in the flesh, and people get sick. But that's just one example, and there are many, many other examples of how climate change is going to impact on food safety. Population, demographics, and urbanization. All you have to do is look at what's happened during COVID in terms of urbanization. Lots of people living in the same areas very quickly spread infectious diseases like COVID. Population demographics, we're all growing older. Older people are much more vulnerable to unsafe food. Their immune systems, are in the process of closing down. And as the populations of older people grow, you get a greater population at risk from food safety. Shifts in consumer preferences. It's a fact of life that consumer preferences are changing. A good example would be people eating less processed foods and moving towards, let's say, consuming what's perceived as healthy products, something like smoothies, where these smoothies are made up of things like fruit, fresh fruit or frozen fruit. We've seen major outbreaks of hepatitis A associated with imported frozen berries that have been used as raw materials for producing smoothies. So that's just one example of a shift in consumer preferences and impacting on foodborne illness. New technologies, well, all you have to do is look at what's coming down the track in terms of cell-based foods, in terms of things like gene editing of plants and animals, and how all of that is going to impact on food safety. So as a backdrop to preparing the WHO food safety strategy, we looked at all of these, and there's an account of how these factors are going to drive food safety into the future. Looking at how the overall strategy developed in 2020, the World Health Assembly, which is the governing body of WHO, requested the organization to strengthen efforts in food safety and to update their global food safety strategy. And they specifically requested that they do this in coordination with FAO and in consultation with member states. And really, that's really important, the consultation with member states, so that everybody was on board and this wouldn't be something new just coming out of the blue. We look at the process and the timeline. It started in the second half of 2020, and essentially that's when I started working with WHO. They established a new food safety advisory group. They called it a TAG, a Technical Advisory Group, This took quite a bit of time, but it had 24 people from all over the world. They recruited them to advise on the whole process. This TAG group met twice in April and February of 2021. I've included links here to the publications of those two TAG meetings. If anybody wants to see what went on at those meetings, they're online. That was in 2021. We worked all the way through 2021, producing a draft strategy and many different iterations of draft strategy, I must admit, as it went out for consultation to various groups. WHO has 6 regional committees, and the draft strategy went to them for endorsement and to make sure everybody was on board. The mission briefings, they had special meetings with different groups of member states, and there was a written consultation for member states to add comments, and that took probably about 2 to 3 months to go through all of those comments. And then the executive board of WHO met at the end of February of this year, and they endorsed the strategies. They gave it the thumbs up. And this will now go to the World Health Assembly in May of this year. And hopefully it will be endorsed there, and it will be published probably in the fall. Anybody who wants to see the draft strategy as it stands, it's online. There's a link to it, and it's there in draft form. It's the shape, if you like to call it, of the strategy. It's got an introduction and the drivers of change, as I've mentioned. These are all linked to the Sustainable Development Goals. We've identified 5 strategic priorities. Under those priorities, there's a number of different strategic objectives, which I'll talk about. There's an implementation plan, and we've drafted separately joint implementation plan between FAO and WHO, because FAO is in the process of also developing its own strategy on food safety, or what can I say, renewing its strategy on food safety. And there's a lot of similarities between the two organizations, and really it would make sense for the two organizations to work together in implementation. And there's huge benefits associated with that. Just one particular area is in the Codex Alimentarius. Both organizations are from the Secretariat of Codex, so it behoves them to work together. And things like InfoSan, the International Food Safety Authorities Network, which is a platform for sharing information on unsafe food circulating in global trade. There's a section on international cooperation, and then of course monitoring and evaluation is key. Every strategy has a vision and an aim and a mission and so on, but the vision here is fairly simple. All people everywhere consume safe and healthy foods so as to reduce the burden of foodborne disease. And really, the whole focus of the strategy for WHO is on reducing the burden, preventing and trying to control foodborne illness. The strategy itself is there as a guide for member states to strengthen their own food safety systems and to get involved in global cooperation. So those are the vision and the aim of the strategy. If you look at the 5 key strategic priorities, the first priority is really to strengthen national food controls. Now, the national food controls essentially are things like legislation, regulations, things like policy, food standards. There's a lot of emphasis on an institutional framework. This essentially is for member states to put together some form of mechanism to coordinate the efforts of all the different agencies that are involved in food safety. And that's a huge weakness right across the world. In Ireland, we set up the Food Safety Authority of Ireland, which was that, if you like to call it, the mechanism for coordinating the efforts of all the different agencies involved in food control, but not every country has been lucky enough to have the foresight to set up such an agency, and that's a general weakness. Enforcement, and let me say, you can have the best regulations in the world, if you don't enforce them, they're pretty useless. So risk-based enforcement is also a fairly new approach in the strategy. There's a focus on verification and compliance by competent authorities, that industry is actually doing what it's supposed to do. And really in the strategy, the food industry has a primary responsibility for producing safe food. Monitoring and surveillance is also a key in the strategic priority number one. You have to have some form of system for monitoring the food chain and surveillance of things like animal diseases, foodborne disease, and so on. Laboratory capacity to support all of that. And the last strategic priority talks about the emergency response and the need for each member state to put in place an emergency response system. Under strategic priority 2 is really about identifying emerging risks and looking at this whole concept of food systems and emphasizing that a stronger health voice is required, when adapting food systems transformation. That's a fairly new approach that hasn't been in the previous strategy. Increased use of food chain information, looking at data, looking at science, the importance of using science for risk management and underpinning risk management decisions. The idea of taking information from beyond national borders, looking at what's going on a global basis with respect to food safety and utilizing those data. With respect to number 4, I think there are 5 key strategic priorities under number 4, and the key here is to engage with all stakeholders, to bring everybody on board. Looking at things like non-regulatory schemes to enhance food safety. This would be the like of the BRC, the British Retail Consortium. They have standards. GFSI has standards for food safety, and really looking at some of these, if you like to call it, non-regulatory or private sector schemes for food safety. Also sharing verification of compliance with and non-governmental bodies, putting out to the private sector, the possibility of implementing schemes for verification, and also really engaging with food businesses is key. So those are all included in strategic priority 4, and under 5, really it's promoting food safety, as an essential part of trade, and key here is ensuring some form of liaison and coordination among ministries and agencies that engage in food trade, and making sure there's a health voice someplace in that network. So that's essentially the structure of the strategy. For every strategy, you need to have some form of monitoring and evaluation. And I think WHO has been very ambitious in looking at an indicator. How do you know you've been successful in implementing the strategy? But really, over the next 7 years till 2030, what WHO is proposing is to reduce foodborne illness, to reduce the incidence of salmonellosis by 40%. Through the implementation of this strategy. Time will tell whether we'll be successful or not in that particular target, but certainly I think it's a very ambitious one, and that's what they've nailed their colours to the mast on. There's capacity indicators, two others in terms of, you probably haven't come across the World Health Organization, but I put a link in here to the joint evaluation tool for IHR. And this looks at food safety as an indicator of implementing the international health regulations. And there's a scoring system for food safety where you look at the national effort and you say, is there multi-sector collaboration in place for food safety? So is there an agency like the Food Safety Authority of Ireland that, you know, is responsible for bringing everybody to the table? And is there, you know, some form of national foodborne disease surveillance system in place? And there's a scoring system for that in the IHR in this joint external evaluation tool. That's a really interesting concept of how to evaluate progress, you know, against different parameters with respect to whether you are being successful or not. And again, if people look at that joint external evaluation tool, because it's a very useful one, and it really is interesting because it marries in health with food safety, you know, very, very well. Well, the key to the whole strategy is adopting a One Health approach, and the strategy recognizes that the health of people is closely connected with the health of animals and our shared environment. And for sure, that nothing could be more true than COVID-19 and how it's impacted globally, you know, and the need to if you like to call it, work at the interface of animal health, human health, and environmental health. When you think about you know, a One Health approach, it's something that people talk about but haven't really focused to any great degree. And I'd like to just talk a little bit about this whole this One Health and the strategic framework. When you look at human health, food, animal health, and the environment, and you say, well, you know, how are all of these linked? If we look to something like antimicrobial resistance, we're seeing an increase in antimicrobial resistance and the numbers of antimicrobial resistance bugs, you know, really, you know, coming to the fore. Antibiotics are not as useful as they used to be, and we're seeing a lot of people dying from resistant infections. It could have been treated 10, 15 years ago, but using this One Health approach to focus on something like antimicrobial resistance, we're using antibiotics in animal production. We're using antibiotics in human health. From the foods of animal origin, we're getting antibiotic-resistant bugs into the food chain. We're also seeing the excretion of antibiotics by animals and humans into the environment, and we're getting antimicrobial resistance in the environment. So if you just take that one example and say, well, how do we tackle this problem? And I think it's focusing on how to get all of these sectors working fairly closely together in terms of education, you know, drafting regulations, but basing the regulations on research and sound science. So we need more joined up thinking between all of these different sectors. Really, that's what the One Health approach is about. And it's like, just like a Rubik's Cube. But what we need is a better alignment, a strategic alignment between all of these different sectors. We need a multidisciplinary, multi-agency approach where all of the different sectors are working together, you know, at the human, animal, environment, you know, and food interface. And that's one of the real strengths of this new WHO food safety strategy that has introduces the whole concept of One Health and is trying to promote that to tackle some of the problems that we are facing and certainly to reduce the incidence of foodborne illness. Thank you very much for listening, and I will stop